So we have a patient who is asking, what is the recommended frequency and length of imaging, PET-CT, as a diagnostic tool? And I wonder if it might be helpful, since we have a broad range of our audience kind of runs the gamut of newly diagnosed to people who are in remission, people who are watching and wait. Maybe you can explain the frequency and length of imaging for those who are watching and waiting, and also for those who are maybe in remission and those who are currently in active treatment.
Yeah, so I think this is a great question. I think the important thing about PET scans is to recognize where and when they have a role in follicular lymphoma, because they're not used as monitoring tools in follicular lymphoma long term, in either watch and wait typically, or in patients who've had treatment. So follicular lymphoma, when patients have a diagnosis, we like to get a PET scan because it helps us stage the follicular lymphoma a little bit, better than just generalized CT scans. When patients are being monitored and they have a change in symptoms, a change on maybe routine CT scans and their physical exam and their labs, then you may want a PET scan. We always want to get one before a patient requires treatment, and then after a patient has treatment, to help determine the response by PET scan. As far as monitoring in patients who are on watch and wait, or monitoring in a patient who's received treatment, routine PET imaging is actually not recommended. It's not recommended by the guidelines, and honestly, they're not usually approved by insurance for routine monitoring, because they're not recommended. So what is recommended is seeing your physician, usually at a 3 to 6 month window, kind of depending on where you are in your journey. And then usually for routine monitoring, CT scans are done. If somebody's in watch and wait, oftentimes they might initially be done at 3 months, then 6 months, then even yearly, and same with after treatment.